the fact that doctor can bring out and highlight reflects the philosophy and the understanding that this government has about addressing the issue head on. Now, when he talked about population, when he talked about falling roofs, ceilings, when he talked about beds not enough, this is not a problem that just came up 6 months ago or a year ago. This has been a problem that should have been seen for the last 15, 16 years. And nobody in the previous government, including the people who were in charge, were prepared to even talk about it. I mean, when we were in opposition, we used to take pictures of broken windows, and we asked the question why, and that is why in the budget, Vijay, we made it a priority. We increased the budget for health ministry by $53 million, one of the highest allocation. Then we realized that maintenance had not been done. Health centers around not just CWM hospital, health centers around the country were falling apart. You go to Draketi, you go to Vanikoro, you go to Nasori. Nasori Health Center is now being fixed. How many years Nasori Health Center was falling apart? Why wasn't being done? Because they were concerned about some novelty projects, building new things, not repairing and maintaining what was there, which could have saved the papers in a big way. So, as I said, he is absolutely right that, some of these things that he is now talking about, he would not have been able to say a thing about it in the last 15 or 60 years under the previous government. Now he can say it, and we realize that that needs to be done. So a lot of work is being done. I can give you examples of health centers which have been fixed. Draketi, Korovo, Nasori is being done. Kandavu is being done. We're looking. I went on a tour of the West. I went to Singatoka Hospital. We built a hospital in Kayasi. When all that money could have gone into the Singatoka Hospital, we could have put an ambulance there. We could have equipped Singatoka Hospital, which would have looked after all the people in the Singatoka area. We went to Nandi, and we realized that the biochem machine, which provides the results for blood test and all that, 500,000 cost. I was only put in there recently. Before the patients would go for a blood test, you have to wait for a few days. It has to go to Latoka. Now, if they do it in the morning, they get the results in the afternoon. If they do it in the evening, they get the results in the morning. I went to Tabua Hospital. There was no washroom. And these are things that were not being done, not because the money was not there, or not because the allocation was not there. It's just that the attention was not being paid. So, simple answer to your question about health. Health is a major priority for this government, and we have demonstrated our action by including a big increase in the budget, putting aside specific allocation. I talked about this before, specific allocation for buying, for purchase of equipment, machines, so that people could be tested, services could be provided, diagnosis could be provided in an appropriate time. So that's the priority of the government. And in fact, if you look at our future, plan, in the next 3 years, we want to improve health service delivery experience for patients through continued strengthening of primary health care and improved, continuum of care. Because primary health, everybody knows in this country, we used to have very, very good primary health care. And part of the reason why so many people are ending up in hospitals is because the primary health care, primary intervention is not there.